Hi, I'm Dr. Ron Tribble, and I am the President CEO of Radiatric. We are a medical device company, and we've developed some interesting technology that treats bloodborne infections in a way that is non-pharmacological. What we have is we've developed a very sophisticated LED technology that will be targeted at bacteria that is in the bloodstream. And the way the LED technology works is we have defined out specific wavelengths of light that operate at very tuned frequency and basically intensity. And we have a treatment chamber where blood is circulated through, basically like an extracorporeal device. Imagine like a dialysis machine. So blood is removed from the body, any port, goes through the device, is treated in the chamber, and the way it works is by an absorption process. Bacteria have certain organelles or molecules inside of them. We target one of those molecules very specifically, and that light energy we have is absorbed by the molecules. And that effectively releases free radicals and essentially kills the bacteria. So far we have tested 3 different mammalian species of blood, and all of our testing to date has shown that we do not harm any of the actual blood cells. We are targeted specifically to the bacteria. There should not be a recovery process because we act in an entirely different mechanism than antibiotics do. So if you're dealing with antibiotics, you're finding a particular protein that you can bind to. And the reason that you have problems with recovery from antibiotics is you're essentially knocking out everything that the body has as far as any type of bacteria. There's a lot of useful bacteria, even if it's IV or oral. Our technology is targeting the specific bacteria, not harming the blood cells, not harming drugs that are on board for the patient. So the recovery is really not going to be a factor. The treatment time is approximately, we envision about 90 minutes to 2 hours to be able to cycle a certain number of changes of the blood to go through the device and be effective. Each change of blood is going to effectively get more of the bacteria. Because if you're 90% effective the first go around, you're going to get more of them each time. So logarithmically, you're reducing the bacterial load. This would be primarily systemic, but a lot of times those localized infections, say you get a wound that gets staph in it, before long you could end up with a sepsis. So the design of the technology is to be used safely at any time, because if you're not harming the patient, you are going to be able to have that suspect case that you still want to treat. Where if you're dealing with antibiotics, if you have a case that you suspect sepsis, you're going to be treating that patient with antibiotics, and you're not really certain if you've chosen the right antibiotic. So in some cases, in order to decide by culture, do you have the right antibiotic, you can waste 24 to 48 hours. And if you've missed the mark, then you've missed that opportunity to treat sepsis or that infection at an early enough stage to be effective. Sepsis, as you're probably well aware, is one of the most leading cause for hospital-acquired infections. That's the name for sepsis, basically, and it is one of the largest killers of patients in the hospital. It's also one of the largest reasons for readmission to hospital, and it is one of the most costly things to treat in the hospital with not good outcomes. So we're looking at how to envision a better outcome for patient care. This is actually my first attempt to raise funds for the company. We have been completely self-funded up to this point by 3 founders, and we have spent approximately 4 years working on our technology to make sure that we had something that was developed to the point where we have a working, viable prototype, and we've done an extensive amount of in-lab testing, and we are now at the point where we're ready to go to animal studies for safety and efficacy. I'd just like to say that we have spent our time over a 4-year period making sure that our technology, to the best of our knowledge, self-funded works. So we're here at LSI now with a plan in mind. We have a university setting chosen already to do our safety and efficacy studies. We have the protocols developed for these studies. We have our principal investigators in place, ready to go. So we have the next stage of our development process well mapped out in place, and we are now essentially going for our first funding round. So we're looking for investors. We're also looking for strategics that might want to look at us as somebody they want to partner with at this stage to engage with us in the further development of our device.